Next, we have Dementia Research Advisory Team members Carmel Geoghegan and Sean Mackel. They're going to give us a little oversight as to what the Dementia Research Advisory Team does and a little bit about their own motivation for joining the team. Go ahead, Sean.
Good morning, everyone. My name is Sean Mackel, and I was diagnosed with Alzheimer's in November 2018. That's almost 2 years ago. When the doctor told me that I had Alzheimer's, he said it was a terminal condition. There was no cure. He recommended that I put my affairs in order. When I asked if there was anything at all that I could do, he said, keep off the red meat. Keep off the red meat. That was the best he could do. And that's why I'm here today. And I'm delighted to be here with my colleagues from the Dementia Research Advisory Team to talk about research and what we can do about that. So I'll just now pass over to Carmel at this stage, who wants to say a few words.
Thank you, Sean. Good morning, everybody. I'm delighted to be here. My name's Carmel Geoghegan, and I'm from the west of Ireland. And I was a primary carer for my mum, Angela, from December 2010 until end of life, January 2014. And Mom's journey was she got a very late diagnosis for vascular dementia and frontotemporal. So my dad died December 2010, and then Mom came to me, and we had noticed over the years a big change in her personality. She'd become very withdrawn. She wasn't able to hold a conversation with more than 2 people. So, and she'd had several falls, and she was suffering from osteoporosis. But then when I went on to get a diagnosis in January 2011, I brought her to a geriatrician who referred her to a neurologist, and that's when the dementia was mentioned. We see now why she was having the falls. It was strokes, but unfortunately the dementia wasn't diagnosed. So on receiving the diagnosis, we left the hospital that day with absolutely no information, no supports. I'd never heard of dementia. I had heard of Alzheimer's, but nobody in the family had ever been affected by it. So we went home to a very lonely space, no interaction with anyone about it. The GP really wasn't up to speed. He said it was part of the aging process. And we continued like this for a number of years, just fighting for supports. Everything was an argument. And then I started a course in NUIG social gerontology with Professor Eamon O'Shea, and that opened up a whole new world to me. I also got involved with the All Ireland Institute Hospice Palliative Care at the time, so I learned what end of life really meant. And then I got involved in various other campaigns, and after Mom passed away, I became very involved because my life had this massive void, so I was completely lost, and I found life unbearable, and I suppose this was my way of grieving. And I know I was quite angry, and I'm sure some of my colleagues here would agree with that. So I began my advocacy work with great energy, and then later I got involved in the research, starting with an NUI Galway PPI group. And again, that opened my world to research. So, and as of now, I'm a member of the Dementia Research Advisory Team, which is a group of people living with dementia, family members, whether they're supporters or carers or just members. And now also we have health and social care workers. And we all get involved in research in a PPI capacity. So what does this mean? It means we all work together with the researchers and we support them to write funding applications, develop research questions, data collection planning, and we help interpret results from our lived experience. So I've been involved in many research projects over the years, but I suppose one of the highlights was involvement with Kieran Walsh, which was through UCC, and Kieran did his research for his thesis on the use of antipsychotic drugs in nursing homes. And I found this was just such a positive piece of research, because the nursing home that worked with him had practically 100% patients on antipsychotic drugs. And at the end of the research, there was only a minimum using the psychotic drugs. So we see how important from this, how research is the core of change. So aside from getting involved in research projects, the group, we meet every couple of months and we plan our activities and we decide what we like to focus on. We also contribute to the Alzheimer's Society of Ireland funding decisions. And the most recently was for the Health Research Board Joint Funding Scheme, which was worth €160,000. And we also will virtually attend the Alzheimer Europe conference next week. So co-research and PPI needs involvement right from the beginning of the research projects. And some decision-making capacity has to be given to the PPI contributors, that we're not just a ticking box exercise. We know this isn't always easy for you. So obviously we have written guidelines with the support of the PPI Ignite in Trinity College Dublin. And this will help you to plan our involvement. Now we're going to go back to Sean, who's going to tell you a little about why he gets involved in research.
Okay. I suppose it's not a title that I would have chosen for myself, but as an expert by experience of dementia, I believe that I have an important contribution to make. There should be more opportunities for us to bring those valuable insights to dementia research in Ireland and internationally. Being involved in research is empowering. It gives me a sense of hope. Research offers hope. It's only through research that we can understand what causes the condition, develop effective treatments, improve care, making living with dementia better, and hopefully one day to find a cure. I believe that people living with dementia and their care partners should be given greater opportunities to be involved in the design and the process of research. People living with direct experience of dementia can make valuable contributions to the design and direction of dementia research projects, particularly those addressing dementia care and services. We can also improve the way the results are shared by coming up with ways to best tell the public about the research in an easy to understand terms. When you are afflicted with dementia, you want to understand the research, but that can be hard. We can help you communicate results in a way that is easy to understand and accessible. I live with this every day. My partner lives with this every day. My colleagues live with it, so they can see and experience things that those who don't live with dementia don't see or might not know about. We can bring those insights to the table to add value to the work and help researchers to do new and accepting work. Carmel?
Thank you, Sean. At this stage, I'll just tell you about the two other groups that are part of our format, and there's worked separately. We have the Alzheimer's Society supports the two groups, and the first is the Irish Dementia Working Group, which is made up of people with a diagnosis, and they have been an amazing group. And I'm a member then of the Dementia Care Campaign Network. And both groups are advocacy groups focused on raising awareness, influencing policy, and creating change. and they've been doing incredible work, and I can definitely vouch for that. There's been such change over the last number of years. And at this stage, I'd like to acknowledge our CEO, Pat McLaughlin, and all the team, because their work was acknowledged yesterday in the budget. And that's been an incredible, just an incredible achievement. Now, the three groups work, as I said, totally separate, even though you might see that there are similar faces in photos and webinars. We all wear different hats at different times. So I just wanted to say to you at this stage, if there's any projects or anything you're working on and you'd like to get our input, we'd love if you just get in touch with the Alzheimer's Society, and then they will come to us about it. We understand the importance of research. That's why we give our time, and most importantly, we give our lived experience to help you do the best possible research. Change and new legislation comes from good research, which impacts all our lives. Thank you.
Powerful input, Sean and Carmel. I think we can all agree. Thank you very much, guys.